Somebody asked me this morning what number symposium this was, and all I could come up with was somewhere between 15 and 20. Dave, what's the number? 17, thank you. Yeah, 17 symposiums, and we started at CHOP in a very tiny room. And it's exciting that, we've got such a packed room here this morning. So I want to just go over a few housekeeping issues and then begin the program. Just so everyone's aware, we are streaming all of today's sessions through our Facebook channel. We've had more than 150 people sign up to join us online. So it's not only all of you in the room today, but it's also our community members who are joining us remotely from home. Hi, everyone. Thank you for being here. We can also take questions from you if you put them into the chat online. We'll try and bring your questions forward as well. These symposiums are not just learning experiences, right? This is a chance for our community to gather, get to know each other, support each other, and so encourage you during the breaks to take time to spend time together. So in your packets this morning, maybe if I can advance my slides, maybe? There we go. So in your packets this morning, there's a lot of information for you. The FARA team has put together all kinds of resources that are in your welcome packets. There are also surveys. We'd love your feedback, so please take time to fill out the surveys. Our agenda for today, we're going to start off with clinical management section with our amazing team from CHOP. Then we're going to move into a Living with FA panel focused on exercise. And I encourage you all to pay extra attention to that because later in the day you're going to get some research updates that are directly relevant to that as well. After the Living with FA section, we're going to go into advocacy. Can you advance my slide? This is not working. Thank you. Advocacy, we are going to have a photo at 11:25 and really encourage everyone with FA during that break, get right out front towards the lobby. If it's raining outside, we won't be outside. Laura will find another spot for the photo, but want everyone to participate in the photo this year. And then after the photo, we're going to go to breakout sessions. In this room and on the live stream will be the speech breakout session. Back in the other ballroom where we had the reception last night, we will have a wellness session. And then downstairs, there are additional meeting rooms, and that's where the caregiver sessions will be held. Then after lunch, we're going to come back and have our keynote address. And our keynote address will be given by Jeremy Cowart. We're really excited to have him. You will not want to miss that keynote address. Make sure you are here right after lunch. Then we're going to have, I'm going to moderate a session with our industry partners with pipeline updates. And we're going to finish the day off with a research session. And Dr. B from the FARA Board and Scientific Advisory Board is going to give us an exciting genetics update. And then Dr. McCormick is going to give us results of an exercise study, which is why you need to pay attention during the exercise panel. I want to give a special thank you to our sponsors. Our presenting sponsors, Biogen and PTC, our many other sustaining and supporting sponsors. That is why we can put this symposium on. It's why we can make it available to the community free of charge. That's super significant to us. When we started this, we didn't have that kind of support, and now I have to use my outside voice. Where's Randy? When we started, we had to charge families a small registration fee, and so it means a lot that we can provide these services, provide these events without having to charge anyone. We also this year knew, thanks to support from Biogen, are able to offer Spanish translation, Spanish interpretation of all the sessions. And so for families who are either here or online, if you need the Spanish translation and you have not gotten connected to it, please raise your hand or put something in the chat, and we will try and help make sure that you get hooked up with the interpretation services. We also have translated materials out at the registration desk if you would like all of your materials in Spanish. All right, now I lost my slides and I don't remember what was next. I can only see myself on this screen right now, which is really fun. I know. Now I got the slides back. Thank you very much. So for those of you who are new, I just want to share a little bit about FARA and who we are. FARA was founded in 1998 by Ron Bartek and his wife, Rachel. Ron, where are you? Woo, there he is. They founded FARA because their son Keith had been diagnosed with FA. They and we believe that advancing research can treat and cure FA. But we know that we cannot do it alone. So we built FARA on partnerships. We foster collaboration among researchers, our patient community, our clinicians, and we feel a strong sense of urgency, the same urgency that you all feel. And we believe that working together leads to deeper knowledge and faster breakthroughs, and helps us build a strong treatment pipeline. This is an image of what our treatment pipeline looks like. Hopefully you've all seen it. We're going to spend some time going through it this afternoon during our pipeline session, but these are all the different treatment approaches that are being developed right now for FA. Having different treatment approaches is really important. Can you go to the next slide for me? We believe that we have to tackle FA, right, through multiple different mechanisms. We know that one treatment won't be sufficient to reach our goal of curing the disease. And we need lots of different approaches. And so when we talk about funding research, it's actually funding research on these approaches. Next slide. And this is just an example of some of the researchers that we're funding that are doing different work in different areas to help us grow that treatment pipeline. This year, next slide, we're going to fund over $10 million in research. Yeah. And that's because of all of your support. And we have partners globally helping us. 6 other advocacy groups are helping us fund research around the world. FARA Ireland, FARA Australia, French group called AFAF, a group in the Netherlands, a group in Belgium. So it's all of us here, but also our partners around the world who are helping advance the research, and that's where we also fund research. We fund research globally. So funding research is a big part of what FARA does, and another part of that research is what we call our clinical research infrastructure. And really what that is our natural history study and making sure that we have clinical research sites actively engaged in research and being able to conduct clinical trials. And so any of you who have gone to one of these centers and done one of those dreaded 9-hole pegboard tests or answered all the questionnaires or done the MFARS exam, your contribution to research is part of a global effort. And that data gets used by other researchers around the world as well. And then another big piece of the puzzle is all of you and being engaged in the community and being a part of being informed. And so you're here today, you're listening online, you're crushing it. You got it. But we also have to help the folks who are not here in the room, right, become aware and become educated. We updated the FARA website about a year ago. We are constantly putting new information on the website. It is an amazing source of information. Literally, stuff comes out at 7 o'clock in the morning from one of our industry partners, and the FARA team is trying to make sure that you have access to it within the hour. We are always updating the website, new content every day, sometimes multiple times a day. And so just encourage you to keep that kind of on your regular rotation of things to look at. We made some changes in terms of how you can get connected to clinical trials. So if you want to get the latest information, what do you do? What do you make sure you're watching? Well, we put all new information about trials out on social media, and every Wednesday we're sharing information about a different open and enrolling study. We also have a clinical trial finder on the website, and that's the place you can easily go and see everything, and you can sort it based on different types of criteria, based on age, based on the type of study. And then finally, we have a mail list, an email list. And I would encourage you all to make sure you're on the email list. We put out monthly updates, and in the monthly update, there's a full list of all the open and enrolling studies, but also all the other events and information that's relevant to the community are also in that monthly update. And sometimes we'll do special, individual emails about specific studies and opportunities. There are two studies I just want to mention briefly. Our colleagues from Mass General are here. Can you guys raise your hands? Where are you guys? I can't see them, but hopefully they're here. They're here to help you understand about a new study that they're doing called the NeuroBooth. And this is to help us be able to diagnose FA better in neurology clinics, and also to develop measures through digital devices, wearables at home. This study is possible because of your advocacy. You advocated for more funding through a program called CDMRP, and that became possible, and they got a big grant, and that's funding this study. So they're looking for individuals who are between the ages of 8 and 30, who can go to Mass General for a day and participate in all these cool NeuroBooth studies. I did it in early September. I went and I did the whole NeuroBooth. It was pretty cool. And they have travel funds, so it makes a really great family vacation. Boston's a great city to go visit. Lots of history, lots of good restaurants. We also just launched a partnership with Citizen Health. They are here today. They have a booth outside. This is a new kind of registry platform where when you sign up, you're signing up to be a part of research by contributing your medical records. So they will go out and source all your medical records, going back as far as you can remember, anybody you've seen. They'll get all of your records. They will put it into their Citizen Health platform, but you now have access to all your medical records. You don't have to go to 3 different hospital portals to find your records. They'll be there for you in one place. And then the records, they're using an AI algorithm in the background, right, to help us see trends and new information by analyzing records from a lot of people. And then you get to choose if you want to share those records for research or not. You're completely in control of your information, how you want to share it. And they're launching a new AI advocate so that you'll actually be able to ask questions of your medical records. Like, when was the last time I saw Dr. Lynch? When did I start taking a certain medication? When was I diagnosed with scoliosis? And it'll pull out the information and answer it for you. So hopefully this will be a great resource for you and help us advance research. All right. So those are kind of the main pillars of what FARA does: research, education, engagement, advocacy. And all of this is possible because of fundraising. We can't do any of this without the resources. And it's been a great fall. We've been super busy. We had our energy ball 2 weeks ago. We raised $1.7 million for research at the energy ball. Yesterday with Ataxia, we raised over $384,000. All of that's funding our next grant cycle. So as quick as we bring it in, we try and get it right back out the door. And then we have amazing grassroots community doing fundraising in their hometowns. Erin O'Neill, who is here, has had the longest running grassroots fundraiser in FARA's history, her Fuzzy Buzzy Golf Tournament. We've got new families like the McLaughlins, who just started a softball tournament, Swing for a Cure. And we've got the Gares, right in front of me, who host FARA's biggest, highest fundraising success, grassroots fundraising in the FA soiree. And Michael's got save the dates. Make sure you get one from him. So if you've hosted or attended a fundraiser, thank you. And if you're not sure what it means or if fundraising's for you, we've got some information for you in your packet. The team put together a really fun, like, little make your own journey, follow your own journey thing to give you ideas for fundraising, to make it seem, I know that doesn't make it seem less daunting, but trust me, it does. Like, you can follow just one little path, create your own adventure. But it's really, we're super grateful for a community that, you know, does all the things we need, right? You advocate, you participate, you fundraise. And all of that makes the research move forward, and we can't do it alone. So thank you all so much. We're going to get the program started now, but before we do, I have a few important thank yous and recognitions. I don't want to leave them for the end of the day. So yesterday we had a huge, successful Ride Ataxia event, and a lot of the work goes on behind the scenes. And so I just want to recognize Jenna on the FARA team. Jenna, where are you? There she is. Jenna works with Kyle every day to make Ride Ataxia happen. And I was super proud of her yesterday. She was under the tent, like, leading all the volunteers, telling them exactly what to do. And I'm like, she owns this. This is awesome. So Jenna, thank you so much. And this year, this is our last education event of the year. We hosted 5 different research receptions, including this one this year. We had a number of online webinars for the community. All of that happens because of Kellen Madden. Kellen, where are you? Yeah. Kellen puts so much thought and care into all of these events and making sure that we are all organized and ready to go. But she wants to make sure that the information that we're bringing to you is the information you need and want. And we're really grateful, Kellen, for all you do. And then there's our leader, who brings all these events together, whether it's a fundraising event or an education event or just making our office run on a daily basis. Jamie Dean. We posted Jamie's profile this week, and the title was "Everybody Needs a Jamie," and that is an understatement. So Jamie, thank you for all that you do and all we throw at you at the very last minute without much help or resource, and you just do it and smile. So thank you all, and I'm gonna ask our first panelists to come up. So we have Dr. Lynch, and we have Dr. McCormick and Dr. Lynn, all from the Children's Hospital of Philadelphia, and they're gonna kick off our clinical management section.